Hello, this is Resource of the Week with SolanoConnex, Mental Health, Service Access, and You. My name is Elena Starr.
And I'm Valentina Kelly. And this week, we're meeting with Christine Smith, Substance Use Navigator at North Bay Medical Center in the Emergency Department. Thank you so much, Christine, for joining us today. How are you doing?
I'm doing pretty good. Thank you for the opportunity to just discuss all that we're doing at North Bay Medical Center. Appreciate the invite.
Thank you. And thank you for your time. Could you tell us a little bit about the organization that you work for and what you specialize in?
Definitely. So a little bit a year ago, North Bay applied for a grant to partner with California Bridge, which is a statewide initiative to combat the current opioid crisis, the public health emergency around opioids, as well as other substance use. So our trauma director hired me to fulfill the substance use navigation role in the emergency department and inpatient units to just meet patients where they're at, patients who come into the emergency department where there's a concern for substance use, whether that's alcohol, stimulants, opioids, and other substances, to just connect patients to outpatient resources as well as residential treatment and other recovery support services.
Oh, that's awesome. And so you're located at the hospital, correct?
Yes, and in our hospital, we have two sites. So one in Fairfield, it's called North Bay Medical Center, and then our Vacaville Hospital is North Bay Vaca Valley Hospital.
Awesome. What kind of services do you guys provide when you're meeting with somebody?
Mm-hmm. So for instance, if a patient comes in and they're in withdrawal from opioids, they'll come into our ED. They'll first meet with the triage nurse to kind of let us know what their symptoms are. And after their waiting period, they'll be met with the physician who can go over the possibility of them getting medication-assisted treatment, or MAT for short, which is usually buprenorphine, and that's the medication that helps someone with their cravings and withdrawal symptoms. And then from there, a doctor will put in an order for me to meet with the patient and ask if they would like to get a referral to MedMark Treatment Center or another outpatient program to not only just get medication management assistance with their withdrawals, but also counseling and therapy as well.
Awesome.
And for those that are accessing your services, is that mainly clients that are coming in through the emergency department, or do you also get outside referrals to have a substance use navigator help a client?
Yeah, so I primarily get referrals from the emergency department. So I also work with our social services team. So I also get referrals from them. But definitely I've gotten calls from community members from other organizations that have a client that is looking for MAT or medication assisted treatment clinics, including out of county, because again, this is part of my role as part of a statewide initiative through California Bridge. So a lot of other hospital sites have substance use navigators, and I'll get referrals from other sons as well.
Awesome. I actually have a question. So you said MAT, is that correct? Can you let us know a little bit about what that is?
Yeah, so MAT for short, medication assisted treatment, is pretty much, I kind of like to think of it, it's like someone that's a diabetic that needs insulin. Pretty much when somebody that has an opioid use disorder, there tends to be withdrawal symptoms when they stop using opioids. So that could be abdominal pain, nausea, vomiting, irritability, sleepiness, and MAT or medication assisted treatment is medication to help with those withdrawal cravings. And it really helps link, or we see better success rates with patients who not only have the medication assisted treatment, but they're also linked to a counselor to discuss their underlying or core issues around their substance use or addiction.
Oh, thank you so much. That's really helpful.
And is there anything that community members should know when requesting services? For example, when they meet with you, is that in person or is that virtual only right now?
I meet with patients in person, but also I do telephone services as well. I think what I would love to say to community members is don't feel judged or ashamed of coming into the ED asking for services. If you want to be discreet, you don't have to check in. You can speak with a receptionist or one of our security guards and ask for me, Christine, or you can say I'm here for the substance use navigator, and I'll be sure to follow up with you.
That's fantastic. And do you take all insurances, or are there any costs associated with getting this service?
Well, that's one of the highlights of this program, is because we know the emergency department is kind of the access point for underinsured or uninsured patients. We can't turn anyone away. It's the emergency department. So the great thing is that I'm also linked or in partnership with outpatient clinics such as MedMark that has services available for undocumented, underinsured clients so that they can access MAT regardless of their insurance status. And there are resources available, whether it's nonprofit organizations or outpatient clinics that will take patients regardless of their insurance status. It's just about doing the research and finding good local partners in the community to link patients to those resources.
That's great. And just a last question, and before I pass it on to Elena, do you offer this service in languages other than English right now?
So at the hospital, we do have our translation services. Sometimes it's an iPad. So if I meet with a person and patient, we can connect with an interpreter. But if it's done over the phone, I also have access to that interpreter line. It just would have to be like a 3-way call. But definitely we offer services to non-English speakers.
Great. Yeah, I just wanted to kind of go back to how people are connected with you. So it sounds like if somebody was experiencing something that was related to substance use, whether it was alcohol or maybe a drug related,
Yep.
they could go to the emergency department and request to meet with the navigator. Is that correct? Or
Yes, that's correct. And it's kind of just been word of mouth, at least in my experience so far in this role, is I meet with one patient, connect them to a residential treatment program. You know, a lot of time patients come in, I have access to, you know, their emergency contacts or family members, speaking with their family. And then I get a referral from a family member saying, hey, I have someone else in mind that I think would benefit from this service or would like to speak with you about their substance use concerns and wants to get familiar with Solano County's resource and system of care for adults with substance use disorders. So pretty much how referrals, word of mouth, community members, social services, which is another department at our hospital. Sometimes I'll get a call from social services to say, hey, I have a patient here who has other, you know, concerns outside of substance use, but, you know, they discuss that they would like assistance with finding, you know, outpatient programs, detox centers, and residential.
great.
So any and everybody pretty much when it comes to referrals.
No, that's really good. And I just have a couple more questions. So if somebody didn't feel comfortable or they didn't want to go into an ED, could they call you, or is that an option, or are you kind of like an in-person?
That's a great question. So my work cell, it's a secure line. I'm the only one that has access to that. So anyone can leave a voicemail, can call, and they can also text. And I'll do my best to get in touch with them as soon as possible. And what I like to do, especially because I don't necessarily know who else has access to that phone, or if someone's calling me and they're with someone that they might not want to share their private medical history, I introduce myself as a patient care navigator. So I don't even mention substance use because I just want to make sure that I'm being respectful of someone's privacy. So, you know, it can be done discreetly. And again, if somebody wants to leave me a voicemail, it's a secure line and I, you know, return phone calls as soon as possible.
That's awesome. And then my last question is, do you serve all ages?
So right now I'm only seeing adults, so 18 and up. I'm still kind of talking with social services manager to see what my workflow would look like when it comes to minors. But I have had parents or guardians of minors call me to just ask, hey, do you know of any resources, any like youth focus groups or youth educational classes around substance use?
And I know you mentioned that people can call you, but is there another way for clients to get information about the services that you provide, like a website or anything like that?
That's a really great question. So at this time on our North Bay website, we don't have like a dedicated site to like advertise. I think, you know, we're kind of working on that now to do a better job when it comes to outreach and advertising our services. But I think at this time, if someone was to call the emergency line and request, hey, I'm looking for substance use assistance, our ED techs, so people that man that phone line, have my number, and they would probably be another way for someone to get, you know, connected with me. But no, at this time, we don't have a website.
And then I think that's pretty much it for our questions, but is there anything else you want to add or mention before we say goodbye?
So some exciting initiatives at North Bay. One of the things myself and our ED or emergency department clinical champion is working on is launching our emergency department Narcan distribution program. So Narcan, that's, you know, the reverse magic when it comes to reversing opioid overdoses, and we want to make it easy as possible, low barrier for community members. So that even means that, a family member, a visitor, not a patient, but just someone that knows someone that is at a risk for an opioid overdose, they can come to the ED and ask for a free Narcan kit. So we're working on our policy. We just submitted an order to the state and waiting to receive our kit. So that's definitely something to stay tuned for. And, we're going to try to do a big campaign to just let community members know that free Narcan kits will be available at North Bay. And then our ED nurses are being trained to do screening, brief intervention, referral to treatment expert, so that someone that comes into the ED that might not disclose that they're coming primarily for substance use, we will have nurses trained to also assist with connecting patients to myself or other substance use resources in the county.
That's awesome.
Thank you. It is. It's exciting. I'm really happy. It's kind of been a process, especially in this pandemic, like everything else, and short staff and just a surge in provider fatigue. But, we want to make this accessible for all community members, especially when it comes to the Narcan.
Yeah, definitely. No, that's so great. Yeah, you'll have to keep us posted.
Will do.
Great. Well, yeah, thank you again, Christine, so much for meeting with us today and sharing your services with us. We just want to remind everybody, again, if you want to learn more about this resource, check out the information in our posts. We also want to remind you, again, if you're looking for any other mental or emotional health resources or services, you can also visit SolanoConnex.org, and that's Solano, CONNEX.org. Thank you so much.
Thank you. Can I give out my cell phone on this, or will it have it?
Oh, yeah.
Yeah. For anyone, whether that's someone that is experiencing a concern with substance use, you have a family member or friend, please give me a call at 510-929-4396.
Great. Well, we'll put that up on the slides too.
Thank you.
Yeah, no, thank you.